Welcome to Myo360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life. Hello, welcome back to Myo360. I am your host, Becca Rose. Today, I'd like to showcase some different myofunctional therapy products and give my opinion on them. So it's important to know that any opinion given is of my own, that was formulated by me based on either myself or my patients using the products. So I'll be offering my opinion. And I also want to mention that two of the products I'm going to talk about, I have an affiliate account with, and that affiliate account allows me to share a link with you that gives you a discount on the product. So those two products are MyoTape and the REM Mastered Straw. So if anybody wants a discount on any of those products, let me know and I will share my link with you and you can benefit from a savings as well. So I just want to get that out there right away. But we're going to talk about these things, and the products we're going to talk about today: the REM Mastered Straw, the Myo Munchie, the Healthy Start appliance, and the TK4 appliance. And then I'm also going to talk about two different types of lip tape. So let's get right to it. The first thing I would like to talk about is the Myo Munchie. So many of the people who find me already know about the Myo Munchie. They've heard of it. Maybe they've ordered it themselves for their child or for their own self. This goes from infant's age all the way to adult size. So it really benefits a wide range of clients. Now, this is a chewing device. This is meant to stimulate the chewing muscles, the facial muscles, help to stimulate the jawbone so we can get more growth of the jaw. There is no age limit, like I mentioned, so it's really beneficial for anybody to incorporate a Myo Munchie into their therapy program. The main theme of this episode is to get the point across that just because you have a product does not mean it's going to solve your problems. I'm doing this episode because I want people to realize that the product is not the only solution. It's not going to fix all your problems all by itself. You need to use the product in combination with myofunctional therapy to get the best outcome. So you're going to hear me say that a lot, okay? And it is really important, and it's true. So you're not going to get the benefits and the outcome of habituated myofunctional therapy by just using a product, regardless of how the product is advertised. Bam, there it is. So the Myo Munchie, this is mine, my personal one. This is the adult size. I carry a few sizes in stock of each size. I have the junior, which is good for 3, 4, 5, 6-year-old. It depends on the size of the jaw. So typically we'll start the Myo Munchie very slowly. We will put it in the mouth. It has all these little knobs on the inside of it, and these knobs help to stimulate all of the tissue, the roof of the mouth. It also has a nice little square, a little tab on here. And this is where your tongue would rest inside your mouth. If you've done myofunctional therapy before, or you know about it, you know about the tongue spot, right? This square is in the same area of the mouth as the tongue spot. You put this in, the first thing we need to do is make sure that you can close your lips around it and that you can breathe adequately through the nose. So this is also going to help with nose breathing, lip seal, and tongue up position. And then we're going to start chewing on it eventually, very gently to help, like I mentioned before, to help stimulate the masticatory or the chewing muscles and the jawbone itself. So at first, I'm going to instruct children and adults, just put it in your mouth. I don't want you to worry about chewing on it or munching on it right now. We're just going to get it in there. We're going to start getting comfortable with it, feeling what it feels like, letting the tongue explore where it is and how it's connecting the different parts of the mouth. And we're going to close our lips on it. And we're going to do something quiet for 5 minutes. That could be reading a book. It could be tablet time, watching TV, really anything quiet or passive, okay? So we're just going to put it in. Hold on. I have it in, that's why I sound funny. Close your lips around it and just breathe normally through your nose. We're not going to worry about trying to bounce on it. Once you start getting used to it, though, I'd like you to do gentle bouncing. So even though I say chew, I really mean bounce. So we're not chewing on this thing as if it is food or gum. We are bouncing on it. So I like to describe to my patients, think of your teeth as bouncing on a little trampoline inside your mouth, and you're just bouncing up and down very gently. Super, super gentle and slow. So that's the first product I want to talk about today. Now, let's move on to the REM Mastered Straw. This one I am an affiliate for, so I have an affiliate link, and you can save, I'm pretty sure it's 10% off of your purchase, okay? The REM Mastered Straw is amazing. I love it. I love it. But I like to introduce it to my patients at a certain time during therapy. Every therapist is different. Some include it in their kit, like their myofunctional therapy kit, and they want you to start using it like on day one of therapy, and they walk you through it and make sure you're doing it right. Others, like myself, I like to incorporate this at the very earliest, halfway through. But mostly, I like to mention the REM Mastered Straw at the end of therapy. I like to use it as a maintenance tool. The thing about it is that it will make your tongue very strong. It's a weightlifter exercise. It's a weightlifter. So you can buy just the nozzle piece that you put onto your own straw, or you can buy a whole bottle. There's different kinds of bottles. There's plastic bottles, there's stainless steel bottles, and then it comes with a straw. So you can buy each piece individually, but it's a weightlifting tool. There's a lot of the way this is advertised, it's advertised that it's going to cure your sleeping, your snoring. It's like the magic ticket to all of your problems. And it is an amazing product. Don't get me wrong, I love it. But I have to, me as a therapist, I want to make sure that you can swallow correctly before you start using the remastered straw. Because oftentimes what I see, maybe someone came to me and they already used it. So anyone can buy this. You can buy it online, anywhere. You don't need a prescription. Anyone can buy it. So they've come to me and they're like, oh, I got this straw and it's really awesome. And I agree with you, it is really awesome. But then I find that their function is not ideal, right? So when they come to me and they've already been using the straw, I don't already know how dysfunctional their swallow was before they started using the straw, or if the straw potentially made their dysfunction more exaggerated. But what I do know is that you have to, and again, this is my opinion, you have to have a good swallow function established before you use the straw correctly. Because if you don't have a correct swallow already, you're more than likely going to find ways to compensate. So maybe the tongue isn't quite doing the movement it needs to, or maybe the lips and the cheeks are squeezing and sucking to try to get some of the water out. What it's designed to do is so that your tongue pumps up and down against this very long mouthpiece that essentially covers the whole roof of your mouth. You press your tongue against it and it creates almost like a siphon. It creates a suction. It's going to make your tongue and your back of your soft palate very strong. So it's amazing at that. But again, I want your function to be there first so that we don't have you come here for myofunctional therapy and we have to undo habits that maybe were created or muscle compensations or adaptations that were created because the swallow was dysfunctional to begin with. And if you remember from previous episodes, that myofunctional therapy, the biggest end goal of it is to create a correct anatomical, functional, integrated swallow pattern. So if you don't have that yet, I would maybe wait on using the remastered straw. Okay. My opinion. I love the product. I'm an affiliate, so I love it. But I feel like there's a time and place and it should be done at the right sequence. Okay. The next thing I want to talk about are some devices that go in the mouth. There's a lot of talk about the tooth pillow. Many people email me or they send me a message on social media or their patients, past or present, and they ask me, hey, the tooth pillow, it's like the most amazing thing ever created. And I want to talk about a couple of appliances that are very similar to tooth pillow. I'm only going to touch on this a little bit today because I'm going to actually do a bit of a deeper dive into the tooth pillow on its own. But I want to talk a bit about it and relate some similar products. So, both of these products I have here were for my son, who is now 8. But this one is called the TK4. And it's they consider it a trainer. So it's a pre-orthodontic trainer. It's real flexible. I know you can't see me, but I'm twisting it around a little bit. It's really flexible. And it's a good training tool for kids to start wearing in their mouth, like before they would get braces, and it helps to guide teeth into a certain position. The other device that I have here is called the Healthy Start Habit Corrector. And this was provided by our dentist, our holistic dentist. Again, this one has to be prescribed by a dentist. Okay, so there's like a treatment plan that goes along with it, and it's supervised by the dentist. This one is more rigid. It's still soft. It's not hard like a clenching and grinding TMJ guard. It has some squish to it. It has some movement to it, but it has the same type of design as this other TK4 trainer. It has a tab for the tongue to go the tongue spot. It has some ridges that the teeth would sit within, so it helps to guide it. It is more intricately put together. It's a more advanced device than the TK4 trainer, but it's like a growth guidance device. So it's helping to create lip seal. It's helping to guide teeth in children into the right position as they start to lose baby teeth. So and it can widen the jaw as well. It's not true skeletal expansion, but it can help to widen the jaw, especially the younger kids are, because that bony suture that goes down the middle of the roof of the mouth isn't completely fused yet. So there can be some guidance and some growth that occurs with a device like the Healthy Start. This is also going to help with habits. So sometimes this is called a habit corrector. It may help with, because it's putting the tongue in the right position, it may help people reduce tongue thrust. It may help people reduce thumb sucking or biting or chewing on their tongue, nibbling on their tongue. It's not going to take those problems away on their own. We need to put some of the myofunctional therapy to work with it to help it move. But this is fantastic, and it can be used for adults, not for like growing the jaw or guiding the jaw, but to help with some of those habits. Okay. It's a really good device. It was a good training device for my son, who ended up now just 2 months ago, he got another expansion device that's going to actually create some skeletal growth. So it's going to widen the actual jaw and not just flare out the teeth. And his particular device is a removable version, and there are different types of expansion devices, and that's a whole nother topic on its own. So maybe that will be a future episode as well. But those are devices that are similar to Tooth Pillow, and it is important that you realize that Tooth Pillow is not a product. Tooth Pillow is a company, it's a brand, and usually they will utilize a Vivos guide or a Healthy Start guide or something similar. So when you say tooth pillow, you are not talking about a device. And I think sometimes that's confusing to people. The device is actually like this Healthy Start or a Vivos appliance that looks very similar to this. It's similar in design, and they all do the same thing. So I'll dive deeper into that in another episode and talk more about the tooth pillow. It's 50-50. There's like half people love it, half the people don't. But look forward to that next episode, especially if you've been considering the tooth pillow or you have it or your kids have had it. And I'd be really curious to get some feedback too and get some conversations started, like some really good constructive conversation on what your experiences have been. Okay. Last thing I'd like to talk about are different types of lip tapes. So as I mentioned in the beginning, I am an affiliate holder with Myotape by the Buteyko Clinic. Patrick McEwen is the one who designed this. So if you know anything about Buteyko or Oxygen Advantage, that's the guy. He created it. I love it because this is my preferred mouth tape because it's in the shape of a square and it goes around your mouth. It does not cover your lips at all. I'm going to put a piece on and then I'm going to do some talking and some drinking. So it has some stretch to it, almost like a fabric band-aid. It's also similar to like muscle kinesiology tape that sometimes a physical therapist might apply to a sore muscle. I'm going to put it on now. So it just goes right around the mouth and it applies gentle elasticity. So when you're sleeping and your mouth starts to open, it just helps to gently bring your lips back together. We know how important nose breathing is during the day. It's equally, if not more important, to be breathing through your nose at night because you have to get into those deep sleep cycles. And as your mouth opens and you disrupt your airflow, you often get kicked out of those deep sleep cycles. The myotape, you want to use it under supervision of a myofunctional therapist. Again, this is a product that anyone can buy. You don't need a prescription. You don't need to work with somebody, but I highly advise that you, at the very least, have an evaluation with a myofunctional therapist to make sure that your structure is good, your nose is good, you don't have your tongue collapsing into your throat. Do the evaluation and just make sure it's safe for you to use it. Okay. It's really easy to take off. If there were an emergency, you could just open your lips very quickly and it pops right off. I've been talking this last like minute or so with this myotape on my face and I drink with it. You can eat with it. The more you stretch your face, the looser it's going to get. But for example purposes, I've been talking with this. Now I'm going to open my mouth and I'm just going to let it pop off. I rip it off and now I'm talking pretty much. You probably wouldn't know any different, but now I don't have it on my face anymore. The other brand I recently just was introduced to when I went to the IAOM conference back in September. This one is called, honestly, I don't know how to pronounce it. I don't know if it's VO or Bio, but it is the same kind of elasticy kinesiology type tape as myotape, but instead of being a square, it's shaped like an H. So it has a strip that goes across the middle. So you can put it on your lips in the shape of an H, or you can turn it and put it on in the shape of the I, letter capital I. I like it in this position better. So I do have it on, and my speech is a little bit more restricted because I've got the first part of the I is on my upper lip. The long part of the I goes down across my lips, and then the bottom is under on my chin. So it restricts my lips a little bit more right down the middle. It feels fine. Like you can pop it off and open your mouth as big, fast, like you did with the other tape, and it will pop off. I don't like how it rests on my actual lips. And it's not occluding my lips. I can still talk. I could still take a drink of water if I needed to. But to me, it's not super comfortable that it's actually on my lips. I feel like that's maybe more irritating to people, especially in the wintertime when lips are more dry and cracked and chapped to begin with. So that might be irritating. I'm going to pop it off now and I'm going to turn it in the other direction into the shape of an H. And now that middle strip is going to cover almost my entire lip. It's going to keep my lips closed. I'll pop it off now. But you can really tell the difference between how you position that tape and how much of your lips it's going to cover. Now, some people will literally tape their mouth shut. Like the other option is 3M micropore paper tape. And you can find that in like first aid section. And you rip a strip off. And when I do it, I just rip a tiny piece off and I go vertical up and down. So it does cover my lips as well, but that's a more economic way to do it. That tape is relatively cheap. These other tapes aren't that expensive either. It's $30 or so for a 90-night supply. So for a 3-night supply or a 3-month supply. So it's not unreasonably priced. Really, what it comes down to is what feels good to you. Some people love it. They love their lips being taped shut. Others don't. I never advise taping your mouth shut, okay? Because that's how it's perceived in the media when we were talking about lip tape. They depict it as if someone's taking a piece of duct tape and they're just like plastering their face shut. And that is not what lip taping is about. Lip taping is about gentle resistance around the lips or in very small contact with your lips to help create some elasticity when your mouth starts opening. The elasticity of the tape helps to just gently bring your lips back together again so that you can use that as part of myofunctional therapy to help improve the depth of your sleep quality. Okay. And for a lot of people, it's pretty darn game changing. But again, it's not going to solve the problem. Okay. So yes, it's going to keep your lips closed. Yes, you might sleep better, but if you still have a dysfunctional swallow, you might still have a tongue thrust. You might still have problems with your teeth and the way they're shaped and the way they've shifted because you're not swallowing correctly. So there's improper pressure being put on your tongue. So again, it's always a great idea to have a consultation and evaluation with a myofunctional therapist before you start implementing any of the adjuncts or the tools that are often used within a myofunctional therapy program. It really bugs me. I'm being super honest here. It really bugs me sometimes the way some of these products are advertised because they're advertised like it is going to cure your problems. It is going to be the solution to everything that ails you. And that is just not the case. All right. There's very few products in the world that can actually do that. So the way it's advertised really bugs me sometimes because you have that false expectation and then you buy the product, you use it as, oh, it didn't help. Oh, my problem is worse than when I started. If you're going to buy the product, make sure that it's going to be the best for you and that you're not potentially creating a bigger or different problem down the road because the rest of your body and your muscles have to compensate for whatever the product is doing that maybe it's doing incorrectly. So I hope that this was a bit of an informative session for you to give you a taste of some of the different products, how they work, what their purpose is, and how we use them in myofunctional therapy. As always, reach out to me with any questions. And if you want to schedule your discovery session, is this product the best for me? Let me know, and we'll talk about some of the products if you have questions, and then how myofunctional therapy can help you too. Thanks for listening, and stay tuned to the next episode where I dive deeper into tooth pillow. Have a good one. See you soon.
And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.